touch on the spiritual part of psychiatry. People say, well, what is that? Well, let's see here. Prayer, you know, you guys can look up prayer, meditation, mindfulness. Did everybody see that?
Yes.
We're going to take like 5 minutes. You can pray, you can meditate at this table, or you can practice mindfulness, okay? We're going, for 5 minutes, we're going to take a minute and do that, okay? Just silence. You do whatever you please. That was good. So all of these support your connection with a higher power or belief system. Every morning when I first awaken, when I'm lying in the bed, I have to connect before I start my day. And I connect throughout the day. Does anyone tell me what mindfulness is?
So present moment awareness, the here and now.
And everyone's aware of meditation, and everyone here, I'm sure, prayed. There was a model, the biopsychosocial model, that came out in 1977 at the University of Rochester. Dr. George Engel created the BPS. Biological, which means something that you're genetically predisposed to. It could be a cancer, it can be schizophrenia, it can be bipolar, it can be autism, it can be colon disease, anything biologically, you have a predisposition to that. Then you look at the psychological aspects of illness, the emotional, and mental aspects. Let's say, for example, a young person who is living in an area of Inglewood where he's constantly traumatized. Think about this, the psychological impact on that young person. Or we can discuss someone who has early senility, or someone with Alzheimer's, the mentation. Other effects of psychological wellness. Someone could be depressed. Someone could witness a trauma and develop PTSD, become depressed, and even become psychotic, and not be in touch with reality. So psychological mindedness, psychological healthiness is important. Then you look at the sociological aspects, such as the culture within a certain area. If it's African American culture, the Latino culture, the Jewish culture, and think about the social economic values within that culture. And think about the environment that the person lives in. What's the sociological, what are the aspects? It's all, when they overlap, it creates health. It determines health. But what's missing? This came out in 1977. It's 38 years later. What's missing in that? Spiritual. This is a smart group. You guys are brilliant. Biopsychosocial, BPS. BPS is the biological, psychological, and sociological factors that interact in the cause and manifestation of health and disease. So they overlap. A good example for biological. There are studies that show that African women who migrate from Africa here to the United States, once they're high performers, they're very successful in their fields. PhDs, MDs, social workers, very professional. Once they're here 1 or 2 generations, they start having difficulties with becoming pregnant. Why is that? Why is that? We have to look at the sociological factors. They're now in an environment where people are different from them. Racism plays an effect on that. This is a different atmosphere. This is a different environment that could affect their psychological mind, and it could affect them become pregnant or conceiving. Okay? Sociological factors, as stated. Another good example is the studies that have recently come out over the last 6 years about Mexican Americans who migrate from Mexico. Once they're here, the second or third generations, they start incurring our diseases. They've taken on United States, the Western society, their culture to some extent. It's not a closed culture anymore. So some of the things they practice in Mexico, they don't practice here. So they start getting diseases, more diabetes, more hypertension. They're not walking as much, not eating fresh fruits as they did in Mexico. So that's what the studies are showing. Another thing that's happened with the Mexican men, according to some studies, and from what I see, I've treated a lot of people from all different walks of life, every nationality. The women are telling me that the men are different and how they relate to them within the family home and then within the relationship. They're taking on some of these Western ways as far as relationships in the marriage, where they have many other women, and they don't give their money to the family, to the children. So this is something that I'm hearing. This is the research I'm looking at. And then we have to look at psychological trauma. When I talk to these young people, I worked in Inglewood for 15 years, taking care of children for 15 years in Inglewood, as well as the 3 prisons. St. Charles Prison, which is the largest prison in Illinois, the first one ever built in America. IYC Valley View Prison for sexual crimes, about 342 boys. And then IYC Chicago Prison. I was the first child psychiatrist to go there to train the officers, the nurses, staff, and the social workers. When you talk to these youth, and also I worked at the Juvenile Detention Center. I taught doctors at the Juvenile Detention Center on Hamilton. It's the largest too in the United States. You find out that they've really basically given up by the age 8 or 9. They realize their position in society. One politician, a famous politician that you guys know, I'm not going to mention his name, asked me, what happens to an African American boy when he turns 8? Turned into a very long conversation. One of the things is they recognize, as Reverend Moss said, their position in this society, who they are in this society. So that affects their health. Well, you guys mentioned that holistic health. You guys mentioned that spiritual was missing from that sphere. Well, what is holistic health? It's the whole person, the mental, the physical, there we go, the spiritual and social aspects of a person. I like to practice holistic health when I provide care to my young patients and my adult patients when I do treat adults. They all intertwine in the development of who the person is and how you would see the person. For example, a person who suffers from migraines secondary to stress. Let's say a person only gets migraines when they go to the school that she works at, because when she gets there, there's gangs outside of the door. She knows she's going to get bullied. There's obstacles in her way that stresses her out. If this young person were to go home to her parents and they take her to a doctor, he could be a pediatric neurologist, treats migraines, it could be a pediatrician, a family practice doctor. They're going to more than likely give medications. There are some doctors who practice integrative health. Does anyone know what integrative health is? Well, that's the Western health with integration of other types of treatments, alternative therapies. So they're holistic internal medicine doctors today. There are training programs out of medical school for holistic health physicians, internists, pediatricians, OBGYNs, but mostly internists and family practitioners.